Welcome everyone. We're delighted that you could join us tonight for our panel, A Path to Leadership. My name's Hannah Chima. I'm a second-year radiology resident at Penn, and I'm one of your co-moderators this evening. Just a quick reminder, so attendees are kindly asked to remain muted, but are strongly encouraged to post comments or questions in the chat. We'll be monitoring it throughout the event. We also ask that you turn off your video for now, and then we'll all turn on our videos at the end of the session for group pictures. Again, the event is being recorded and will be made available for later viewing. Briefly, to describe our purpose, the Women in Radiology groups at Penn, IU, and UT Southwestern created this panel series to encourage a conversation between the passionate and high-powered women radiologists at our institutions, to encourage networking in and across our departments, to learn from each other's challenges and successes, and to support one another in our professional journeys. We continue to grow and are delighted to have our new institutional partners from Case Western, MGH, and Northwestern, and hope to have many more. Next slide. So to start, let's look at the radiology leadership landscape today. According to data published by the AAMC on gender distribution of diagnostic radiology faculty members and residents compared to medical school graduates over time, there are significant differences in trends between medical school female graduates and female radiologists at various leadership position levels. Since about 1980, there's been a dramatic 30% increase in female medical school graduates. However, the percent of female radiology residents, which initially climbed about 6% between 1980 and 1990, has since remained relatively flat at roughly 26%. On the other hand, radiology faculty and chairs have both seen an increase of approximately 10%, noting that the absolute percent of women in radiology chairs remains under 20%. Next slide. So also interestingly, in work by Grimm et al. In AJR in 2016, the specific breakdown of women radiology representation at each academic leadership level showed that 34% of academic radiologists are women, 37% are program directors, but only 25% are vice chairs or section chiefs, and 9% are chairs. This actually highlights something that is well known, which is that women are overrepresented in education roles as they have more success in obtaining program director roles compared to other leadership positions. Women also serve in more education roles in departments and societies and author more educational articles. That was found in a paper in Academic Radiology in February of last year. Women are underrepresented in other leadership roles, representing only 25% of vice chairs, like I mentioned, and 9% of department chairs. So when combining that data with looking at academic and private practice, 14% of men, but only 7% of women are considered leaders, according to a survey conducted by the ACR. So women are even more underrepresented among leadership positions within research, indicated by women receiving only 16% of NIH grants, having fewer lead author roles and less representation overall on editorial boards. So now we can stop sharing. So before we get started, I'd like to bring your attention to a few Zoom pointers. We suggest that everyone click gallery view in the top right of their Zoom screen. And we also suggest that you hover over any black box with a name in it and click hide non-video attendees. That way that you can see the panelists and moderators. And with the data that I just presented in mind, we'd like to start the conversation by having you all answer a few poll questions. So we're gonna launch the poll questions. So as we go through these poll questions and you consider your answers, I'm going to begin introducing our distinguished panelists. So also a note, given that their awards and accomplishments are too numerous to count, the introductory comments have been abbreviated to leave as much time as possible for each panelist to speak, in no way meaning to diminish any of these distinctions. So Dr. Vasantha Aaron is a nuclear medicine radiologist and has been a faculty member of the Indiana University School of Medicine Department of Radiology since 2010. Her interests include developing protocols in fusion imaging, radionuclide therapies, and advancement of clinical PET MRI. Dr. Aaron also serves as the medical director of radiology for the IU Health Academic Health Center, overseeing patient care and imaging. She is the faculty co-sponsor of the IU Women in Radiology Group and co-chair of the department's Diversity, Equity, and Inclusion Committee. Next, Dr. Jenny Bencardino is Chief of Musculoskeletal Radiology and Professor of Radiology at the University of Pennsylvania. She completed radiology residency training both in her native Colombia and in the US at Northwell Health. Dr. Bencardino trained in MSK radiology at NYU Langone Orthopedic Hospital, where she was promoted to full professor of radiology and orthopedic surgery in 2014. Her research includes the development and validation of MRI metrics for the diagnosis and follow-up of diseases affecting the microstructure and function of articular cartilage, bone, muscle, and nerves. Dr. Senta Bergruen is an associate professor of radiology and medical education at Northwestern University in Chicago. After several years as program director for the DR and associate PD for IR, she currently serves as vice chair of education and diversity for the Department of Radiology. She also established the Women in Radiology Group and Radiology Interest Tracks at Northwestern. Her clinical and research interests include abdominal oncological imaging with MR and CT imaging. Next, we have Dr. Donya Day. She's an assistant professor of interventional radiology at Massachusetts General Hospital and Harvard Medical School. She is the IR Division Quality Director, co-director of IR Research, and director of the Precision Interventional and Medical Imaging Lab. She researches the applications of machine learning and computer vision for precision medicine. She's the founding co-chair of the MGH Women in Radiology Group, founding co-director of the New England Women in Radiology Invited Lectureship Program, and current co-chair of the MGH Radiology Diversity, Equity, and Inclusion Committee. Next, we have Dr. Donna Plecha. She's a chair of the Department of Radiology at the University Hospitals Cleveland Medical Center, professor of radiology at Case Western Reserve University School of Medicine, and co-director of the Diagnostic Institute, which includes the Department of Radiology, Pathology, and Genetics. Dr. Plecha completed her undergraduate degree at Northwestern University, her medical degree at Case Western Reserve University School of Medicine, and her radiology residency and fellowship in breast imaging at the University Hospitals Cleveland Medical Center. She was the division chief of breast imaging for over 14 years and served as the vice chair of operations. She is a fellow in the Society of Breast Imaging and a member of numerous professional societies. Next, last but not least, Dr. Dan Twickler is a tenured professor of radiology and obstetrics and gynecology at UT Southwestern and holder of the Dr. Fred Bonte Professorship in Radiology. After several roles in residency education, she currently serves as the Department of Radiology Vice Chair at Large and Medical Director of Obstetric and Gynecologic Ultrasound at Parkland Health and Hospital System. Her clinical and research interests include fetal and gynecologic imaging and ultrasound and MRI, as well as imaging of maternal complications of pregnancy. So with that, I hope everyone has had a chance to answer the poll questions. And once we complete the poll questions, we can move to the word cloud. So as we're seeing the poll question results. So for the first question, what are the most important characteristics that embody a leader? So 72% of you said good communicator. Number two, what are the biggest challenges to women seeking leadership roles? And let's see, so 40% said selection bias. Number three, are you empowered and supported to address these challenges? And 55% of you said yes. So as we move to the word cloud, I just wanted to describe what a word cloud is and some instructions. So word cloud, we're gonna feature a question and then everyone should answer the question with a one-word response. You can submit as many responses as you like, but make sure that they're one word long. And then as the responses come in, responses that are the same will get larger in size, and the rest of the responses will kind of form around the words to create what is called a word cloud. So the question is, what has been the most important factor to you in your career development? And again, answer in one word, but you can submit as many single words as you'd like.
Opportunity.
You have to, please everyone click on the link in the chat.
So just a reminder, yeah, the link to the word cloud has been posted again in the chat. So you can click on that hyperlink and it should take you to the word cloud.
Hey, Henna, for me, it says that the poll is full and have received the maximum amount of responses. I don't know why they're not showing up.
Same for me. I submitted 3 responses and now it's telling me it's full.
Maybe people can just put some of those words into the chat and we can use that to drive the conversation.
Yeah, I think that's a great idea. Thanks, Dr. Aaron. So hopefully we'll get a good list in the chat going then. So I see mentoring, hard work, mentorship, bravery, sponsorship, drive, mentorship. So lots of good ones. Opportunity, grit. Oh, great. That's a great one too. Open-mindedness, confidence, taking risks. I love these. These are great. Collaboration, role models. We'll have to put them into a word cloud ourselves later and then send it out as our logo at the end of this. Okay, excellent. So I really appreciate all of your responses. These are really great and are definitely going to help us kick off the conversation. And I just want to put one more plug in for these quick Zoom pointers so we can have as a great discussion seeing everyone as possible. So again, we suggest that everyone click gallery view in the top right of their Zoom screen. We also suggest that you hover over any block box with a name in it and click hide non-video attendees. And that way your screen should only show the panelists and moderators. So next, I'd like to pass the symbolic microphone over to my co-moderators to introduce themselves, starting with Dr. Erin Allen-Cherry.
Hi, everyone. I'm Erin Allen-Cherry. I'm a breast imaging fellow at University Hospitals Cleveland Medical Center, and I'm also one of the co-directors of our Women in Radiology group.
I'm Lauren Vasiliadis. I'm a second-year resident at Northwestern, and I'm the current resident president of our Women in Radiology group. And so we will go ahead and start with our questions. The first question is, aside from the academic leadership roles that we highlighted earlier in our introductory slides, what other leadership positions are available in radiology on the local or on the national level?
I can take that. I think that it depends on what's available at your local institution. So our Women in Radiology group is a way to be a leader. Diversity is a way to be a leader. I think you can work with medical students. We have people who have been in charge of medical student rotations, you know, in the institution outside of radiology. There's opportunities as well, and starting with committee work and working your way up to CMO. You can work your way up to COO, CEO. There's different ways that you can go about it. There's radiologists and CMO and different titles at our institution. On a national level, I think it's really important networking wise to become active at a committee level early on, and then you can head a committee. You can be a program director. You know, at Röntgen Ray, I was the program director for the breast section at Röntgen Ray. You could be active at RSNA. You could be on the committee and chair the committee of, you know, for reading abstract submissions. There's so many opportunities, and it's a great way to network outside of your institution, which is also a nice way to find letters of recommendation when you're getting promoted from people outside of your institution, which is really important.
Very helpful, thank you. Our next question is, what makes an effective leader?
I'll take that one just from a very 10,000 foot perspective. I heard Condoleezza Wright at the RSNA one year, and it was probably about 10 years ago. And as you know, she's the dean at Stanford now and a very impressive woman. And she says that people come to her all the time and they say, oh, I want to be a leader. I want to be a leader. You know, can you mentor me to be a leader? And she said, you know, there's a whole bunch of steps before you get to that point. And she says, and I'm not trying to be mean or anything, but like, first you have to do something. You have to find what it is that you love. You've got to achieve competency in it. And once you achieve that competency and love your job, then you say, well, what can I do to volunteer within my job? You know, what is the help that is needed within my job? And I love to see all these bright and talented women in radiology. It's so encouraging. But the first thing that you need to do is like figure out like, what is it that you're trying to do? You know, are you trying to become an academic radiologist? Are you wanting to become the best breast imager in your private practice? I mean, I think it takes, you know, introspection first. And then once you know what you want to do, then you can seek out the resources that you need. So it takes a lot of internal sort of thought processes. And then once you do that, you just have to be the best diagnostic radiologist that you can. And then from there, what can I do to volunteer within my residency? You know, do the chiefs need help, you know? And then after that, what can I do for the institution? And then what can I do for organizations that I'm passionate about? Thank you.
If I can just build on that, I think that's like right on, because one of the things I've noticed is if you are looking to make something better and make it the best it can be, whatever that is, as small as that may be, your motivation, everybody can sense your motivation. If your motivation is to improve things, patient care for your trainees, for your colleagues, whatever that is, the people around you recognize that, and then they want to get on board with you, and then you could be extremely effective. If you're kind of focused inward only at what you can do for yourself, people sense that and may not as readily get on board. So I think that's right on. Motivation is one of the, if your motivation is to help in some way, you're going to get people on board and they're going to listen to you.
Yeah, I agree. I think that's the difference between a successful leader that has a vision and can motivate people versus a manager. A manager is good with, you know, logistics and operations per se, but I think a leader is that has that motivation, that drive, that vision to energize people.
Thank you. Those were all incredibly helpful responses. The next question is for Dr. Bencardino. Have you received guidance or feedback on how to become a leader?
Yes, definitely. That's a very important component in the leadership path. So it's important to identify peer mentors. I believe have been crucial for me in the advancement of my career. Because when you look at somebody who is at your same level, then you can, share ideas, open up, find somebody who can be a sounding board, where you can, a person you can trust and rely on. So I'd say that when we look at mentoring, we're looking at mentoring in 3 dimensions. We look at mentoring in parallel dimension, and I believe in that realm, the peer leader mentors are really, really important. And you have mentors and sponsors that you look up to and can help you to ascend in your leadership path. And you always have to be pulling people who are looking up to also escalate in their leadership in the leadership path. So it's a very dynamic process, and I would emphasize at identifying very good peer mentors.
I would also like to add that I think it's important to be open to mentoring from below as well. And I commonly ask the people that report to me, how am I doing? Is there something different I should be doing? I ask for that kind of feedback because I think you need to hear from both above and below. And of course, raise the votes around you, but also listen to them to help you be a better leader for them.
That's great. Thank you both. So next we wanted to talk a bit about both challenges that you faced along the way as well as successes you've had. So first question for me is, what challenges have you had in your career advancement?
Say for me, I did not even see myself as a leader initially, and it did take others coming to me and saying, this position is open, would you consider it? Let's sit down and talk about it and why I think you might be good for it. It just had not even occurred to me. So I think, somebody else seeing something in me, it took somebody else seeing something in me. I didn't see it in myself. And then at the beginning, certainly suffering from imposter syndrome in meetings, especially in meetings with chairs and directors and CMOs and CEOs who are all men, and I may be the only women in the room. Initially, it was hard to open my mouth and to believe that I had something valuable to contribute. So I would say those were the biggest challenges for me early on.
And to build on that, I would say that I think for all of us as women, work-life balance becomes really a very big issue. And learning early on how to say no. I would say, as probably one of the more junior people on this panel, this is something that has been a very big challenge for me, is learning how to say no and picking the right opportunities to make sure to advance.
I'm just going to share a personal experience from several years ago when I was trying to move ahead in academic leadership. And there was a deadline for an abstract that I had to meet. And I was bouncing my 2-year-old son on my left knee and saying, do I really want to do this? Do I really want to interrupt my entire life to get this abstract done? And at the time you had this midnight deadline. And I agree with the work-life balance scenario. I mean, you just have to ask yourself the question, are you really willing to put in the work and the effort that it takes to get to the next level? And I think that's a really important question, because I can understand sometimes when the question's no, especially when you're balancing that 2-year-old on your knee.
Yes, definitely. And I love kind of where this discussion is taking us. We're definitely going to come back to more of these work-life balance topics in a little bit. And so I also wanted to ask, kind of despite all these challenges, what factors played an important role in your career, or in your success and career growth?
I would say being open to opportunities, being willing to take risks, and being willing to be confident in what you know you're good at, and be open to learning from those around you the stuff that you don't know, and being able to, you know, work with others as a team. I think all of that's really important, and I think having supportive people around you helps as well. But I really think, you know, getting back to the work-life balance, I remember finishing my training, and I had my third child. I had 3 kids under the age of 2. So I had 3, you know, like diapers everywhere. If you had told me on one of those days that I was going to be chair someday and professor, I would have said you're crazy, because it was not on my roadmap at all. So just be open to opportunities. You never know where life's going to take you, and follow your passion. I think that was kind of brought up before.
Yes, I'd like to emphasize also building a network. I think that as women, we are sometimes a little bit late in getting to building a strong professional network. So I would advise everyone during training, when you go to meetings, go up to the podium, talk to the teacher and to the professor that you have an interest, you know, if you have an academic interest in a certain area, start building those connections early on. And it's never too early to get started in that path. So identify people in your professional realm that, you know, can stimulate you, inspire you, and also help to find that niche. You know, like at the beginning, we may be a little bit lost on, you know, identifying what really make us stick. So I advise you to start early in that process.
One thing that helped me, I think, was just being focused and having goals. Like others, I did not start out thinking I wanted to be a vice chair, that was my goal. Early on, I just wanted to be a good educator. When I joined academia as an attending, I wanted to focus on the trainees and my own education and their education. And with time, my goals changed. And I think it's kind of recognizing that you're growing and that your goals are going to change, and being open to that, and being intentional, and with the networking, etc. I think revising your goals, but focusing on them is important as you grow professionally.
Great, thank you all for your responses. So kind of going, you know, back to the topic of work-life balance. Many of us also have very busy family lives, but we also want to be involved and be, you know, involved in these and take on leadership roles. So our question is, how does your institution promote work-life balance to enable women to take on leadership roles and succeed at them?
I'll take a stab at this, because one of the first things that my chairman wanted to do was set up meetings for different types of things, and I just point blank said, don't have them before 8:30. We're carpooling, you know. I mean, can we get much more done in the middle of the day? And one thing that we know about us is that we're really good with time management in most cases. And, I would always laugh at these long drawn out meetings over lunch. And I'm just sitting there going, what a waste of time. I could be, getting caught up on my email and reading a few cases. So I think the big thing is to make people recognize that you're carpooling in the morning, that you have responsibilities after work, and to try to be more efficient while you're at the job, and use your time much more effectively. And I have found that in your group of people, you're incredibly good with time management. And so, make it clear that you have needs outside, and I think that's really important. And then be really efficient. I mean, I've point blank said things like, this meeting's a waste of time. Can we just do it once a month? And I mean, but I think you just have to be really kind of thoughtful with the use of your time and use it really, really efficiently. That would be my advice. Thank you.
And like our department, for certain leadership positions, assigns administrative time for that, so that it doesn't have to take up time after work, weekends, whatever. So I think that's key. If it's important enough that you hold a position to accomplish certain things, then your department should give you time to do that. They should pay for that. In addition, I think we've all learned in the time of a pandemic, especially as radiologists, we can do a lot of work from home. So we're encouraged when it comes to some of the leadership roles we hold, some of these meetings we have, to do it from home. And I think there's pretty much no excuse for that in 2021. If you don't allow for that in your department, something's wrong.
I also think I loved the word intentional. You really have to be intentional about what you're saying yes to, what you're participating in, what you're spending your time on. I've gotten to the point where some days I have to have my days in 15-minute slots. You have to somehow get everything done, and so be very intentional with your time and what you do with it.
Very good. So we have kind of a related question coming in from the chat along the theme of work-life balance. She asks, leadership roles carry with them so many responsibilities it can be consuming. How do the panel members find the roles sustainable? So maybe if you wouldn't mind adding on to that a little bit more.
I would say one of the things I learned early on is delegate when you can. If you have people who can help you, you can extend yourself a lot further and be involved in a lot more things, as long as everything is getting done to the best shape possible.
I agree. And also by delegating, you're kind of giving leadership training to others by having them come on the team and delegating and being more inclusive in that sense. So
I think one of the things that it took me a few years to learn is that I'm not going to be awesome at everything all the time. Mm-hmm. So I'm not going to be the best leader every single day and evening. I'm not going to be the best mom every day, all the time. I'm not going to be the best wife. There's an ebb and flow. There are some days where I am definitely not a great mom, but I rocked as a radiologist. And I think we have to be a little careful to think that we have to be superwoman and be everything all the time. We don't expect that of men. So I don't think that should be expected of us. And it holds us to something that's unrealistic. I think there's room for all of that in all our lives, but it kind of, ebbs and flows.
Great, thank you all. So kind of one additional question that often comes up a lot is, can you work part-time and be a leader in radiology?
I would say yes. Our vice chair of quality is part-time. Erin's co-director of women in radiology is working part-time. I worked part-time before I became a leader, and then I became full-time. But I think it depends on the role. I don't think you can be a part-time chair. I don't think that's possible. But there are some roles I think that are open to that. I also think, to Erin's point, with some flexibility and doing some days at home, you can feel a little bit more part-time maybe, but still be full-time and have that time paid for and accounted for. That if they value what you're doing, they should pay for that time.
Okay, great, thank you.
I agree. I think it's real important that academic radiology makes allowances for part-time work, and your statement, it's just so true, because the breast imaging department has been very successful in being able to accomplish that task because they have the shared need for this work-life balance type of scenario. I was the author of our part-time policy for the department because I felt it was really important, one, that it be formalized to the point that it's acceptable, and in the same respect come up with policies and procedures around them so that there's an element of fairness, due process, and transparency. And what happened was, some of the people who went part-time had a little bit of lull in their academic productivity. That was certainly understandable. And then they came back later, and now they're writing later. And other people have been able to sustain everything while they are part-time. So I would really encourage people to find out if their department or their university has a part-time policy and find out what it is. And if they don't, it would be a nice way to instantiate it just for the purposes of communication and transparency.
Yes, I would say I was a part-time academic radiologist for a long while. And I believe what we need to do is also to maximize the time that we are investing during our part-time work, so that we can also start building up towards the future. So if you are, you having in mind becoming a leader, you can still participate doing journal peer review work. You can participate in committees with the medical societies. You can also get involved in academics, continue writing. I have to say my most productive academic output was actually when I was part-time. Now that I'm in a leadership role, I have all these administrative functions to do that, take away from sitting down and writing papers. So if you are intentional, you can use, this part-time work to build up what you need to become a leader in the future.
Great, thank you. I also just wanted to take a moment to remind all of our participants, feel free to type in questions in the chat, and you can do that at any point just so we have time to get those in. So feel free to put whatever questions you have just in the chat there. There was the topic of mentorship that I wanted to come back to, and I know Dr. Bancardino, you had touched on this before, how important it was to your career development. So we just wanted to ask, how can we as women act as mentors and sponsors to one another?
Well, I think somebody else made a comment in the chat that it's important for women to be leaders, to set examples, and to be role models for others. But I think it's also important for us as leaders to sponsor and bring up those behind us and give them all the advice that we can, and get them any opportunities, increase their network. It's hard work to be a sponsor, which I think may have more impact on somebody's life than some mentoring, right? So I think it's a combination of both.
And on the topic of mentorship, I do want to mention that it's important to think about the importance of having not just one mentor, but having rather a mentoring committee. And different people can provide mentorship in different areas. I mean, you can have a mentor who can provide academic clinical mentorship. You can have someone who can provide research mentorship. You can have someone who can even be your mentor for work-life balance. There are a lot of different things, and I encourage everyone here to always think about who is your mentoring committee, not who is your mentor.
That's great.
I would agree with that. And also look for mentors outside of your institution, and look for men mentors and men sponsors, because if you look at all the graphs and the slides that we saw at the beginning of tonight's discussion, those are the people that have the connections. Those are the people that have, you know, the sponsorship connections that can gain you what you need to get promoted and to be in a leadership position. So I don't know if you've ever heard for he, for she, but it's important to tap into them for sure.
Yes, definitely. Thank you all. Let's see. It's probably a topic we should have addressed prior to me asking that question, but would someone be able to explain the difference between mentorship and sponsorship, and possibly provide an example for those that maybe don't know the difference between those terms?
I can give it a try if
okay.
anyone else would. So the way I think about mentors are people who really can give you guidance and advice when you go to them, but not necessarily outside the confines of the office you're in. But for sponsorship, it's someone who really will go out of their way to find you new opportunities to advance your career. So in order to be able to be successful, you really need to have both mentors and sponsors. In general, sponsors, most of the times, not always, tend to be a little bit more senior and have access to a bigger network and are able to provide you with a lot more opportunities in terms of giving talks or serving on a committee, etc. I don't know if anyone wants to add more.
I think you almost look at sponsorship as promotion, you know. My example is I'm a, you know, I'm on a K grant with a postdoc, you know, and the amount of work and effort that you do in compiling a grant like that is a huge responsibility, and it's really it's a lot of work, and that's a enormous commitment, and it's a big commitment on the part of the sponsor, but it's even a bigger commitment on the part of the person who is willing to be a recipient of that sponsorship. So it's just a much more intense relationship of assuming responsibility and promotion is how I would word it.
I think that's great. I think somebody asked, you know, how do you find a sponsor? How do you get a sponsor? And I think it depends on what your goals are. So if your goal is, you know, to be on a committee at Rentgen Ray, or to be a committee on RSNA, or to pursue, you know, some part of some national meeting or something in your institution, find someone that can open that door for you, so that sponsor can do that. And you have to realize that the sponsor is putting their reputation on the line for you. So you have to deliver whatever your sponsor's, you know, giving to you. It's a gift. You have to put your all into it and really earn more sponsorship from that person. And so I would agree that that is a big responsibility, bigger on the person who's being sponsored than the person who's sponsoring.
Very helpful. Thank you all. And I will turn it back over to Lauren now for a few more questions.
So shifting gears a little bit, I wanted to touch on imposter syndrome, which we had mentioned briefly earlier. How do you increase your confidence and overcome imposter syndrome or any self-esteem, confidence issues that you may have struggled with in your path to leadership?
I would recommend, if somebody is struggling with that, there's a book called The Confidence Code that I think would be really helpful. I don't know if anyone's read that. I thought it was very helpful. But I think the advice that I would give is to look at yourself and see what your skill sets are. What are you confident about? Don't concentrate on what you're not confident about. Concentrate on what you're confident about and what are your skill sets, and that's your tool belt. And you should be able to walk into any situation and rely on that. Build on that skill set, build on that tool belt, put more things in your tool belt. But when you're walking into a situation, a job, a committee, a group of men, internally figure out what you feel really good about and use that to project yourself and to get the work done that you need to, and to be heard. And don't always concentrate on the positive of yourself, not the negative and not what you're lacking, because you're going to grow what you're lacking. But you're really good at some things that'll help you in these different situations.
Yeah, we actually read a couple of chapters of the Confidence Code in our Women in Radiology group that was sent as idea last year. That was a very helpful answer. I love focusing on the positives. That's something that seems very easy, but we often forget to, believe in the positives that are right in front of us and acknowledge them in ourselves.
The other thing I think that can be helpful, particularly for trainees or people early in their career, is to get feedback from peers. Because sometimes we doubt ourselves and we don't know our value, but if you ask people around, your peers, faculty that you respect, for feedback, you can hear the positive. And of course, if it's constructive, they'll also give you, feedback on what you need to apply yourself and improve upon. But hearing the positive and just kind of at night reflecting on that and moving forward, I think really helps with the self-doubt and the imposter syndrome and increasing your confidence. So leverage your peers as well.
And one of the things I would also say is making peace with taking risk. I think as women, we're all very risk averse, and really thinking early on that sometimes it's okay to take on an opportunity that you don't feel 100% ready for, and figuring it out. I mean, I had this conversation early on with one of my mentors. I wanted to be 100% ready for an opportunity, and he told me, just take it and you'll be okay. And I was okay. And I think this really demonstrated that sometimes we really overthink some of these things, and imposter syndrome does come into play. So just take it as a risk, and most of the times you'll be okay.
Yeah, and just to add to that, it's like the stretch, most men, if they only have, a couple of qualities or qualifications for a job, they'll apply for a position because they think they deserve it. And women want the 100%, just like you had said. So try and stretch and move outside the box.
Thank you. Those are all incredibly helpful responses. I agree, that is a thing known about women going for promotion. We want to be 100% ready, and men can be 20% ready, and we'll go for the same thing. Our next question shifts gears again a little bit. How do you think our male colleagues can support women radiologists in becoming leaders, and women radiologists that are already leaders?
Well, I have another story. There was this incredible resident, okay? And she had it all, brilliant, everybody here, brilliant, great radiologist, got along well with everybody. And I said, you should be chief resident. And she was shocked, completely shocked. Like, me? I'm there yes, of course, you've got everything that it takes to be a great leader, but you have to let people know that you want to be chief resident. And you have to, and make sure that you're getting the positive feedback from your peers that they think you could be chief resident. So my advice is just to talk it out, talk to people. And our job is to bring out the best in you, you know? And so I just said, you know, you give me the word and I will be your grassroots advocate. And I will tell all the faculty to vote for you. And then we can work on getting the residents to vote for you. So I think we deserve it to each other to point out all the wonderful assets that I'm sure everybody on this phone has, and talk about it openly and see what you guys want to do, and then become advocates for each other. I think that's the most important thing.
I did.
The other thing, go ahead.
Oh, no, I'm sorry. Go ahead. I would be switching topics. So you go ahead.
Okay. One thing that just came into my head is, you know, I was talking about the positive. Think about the positive things you can do or that you're good at. The other thing is, I would recommend you write down good things that you've done, things that you've accomplished. I think we always concentrate on what we're trying to fix and what's not working and how are we going to fix this. But if in the meantime, as you do fix things, write them down, make a list so that you can go back and look at that and say, look at all of the accomplishments I've actually made. And as you review that list, when you're talking to, you know, your boss or a mentor or a sponsor or whoever it is, male or female, you can communicate in a way that you can say, you know, I'm really proud I did this, and this shows how I had teamwork or how I had leadership or whatever it is. And that's kind of things that you can have in your head if you're ever in an interview or if you're in the hall. You know, I just think you have to have that kind of, I don't want to call it an elevator speech. I don't know what it is, but it's kind of your identity of what you're good at, what you've done, what you've accomplished. Don't ever forget that, because I think people just move forward and concentrate on the next thing to tackle, and they don't stop and reflect on everything they've actually accomplished today. And I tell some women, think about yourself as the middle schooler that you used to be, looking up at who you are today. What do you think she would think of you right now? She would think you're awesome. And you don't always think that about yourself, right? Or you can think about, what would you think of, you know, I just think we need to have that to help with that imposter and the bravado and just being able to compete with the men for particular positions.
That was a great answer. I love thinking about the middle school version of myself. What would she think? I think that's a really great exercise that we can all practice. Middle school version, high school version, college version, pre-med school, all of that. So we have our final question, which kind of touches on what we're talking about. But again, what are other ways that we can promote women in leadership roles? I know we've talked about women getting into leadership roles. How can we support women that are already in those roles, or encourage them to aim higher and keep going?
I think as women leaders, we can be very thoughtful and deliberate about the younger women in our programs, whether trainees or other faculty, and, you know, help them see themselves as leaders, help them see what they can accomplish. And I think, especially based on what was just said, help them see what they've already accomplished, help them see the traits within them that you see that made you go to them and say, hey, I think you could be a leader. So I think, you know, sort of reflecting back on some of the younger women and helping them see themselves as leaders to begin with helps.
Yes, I was about to say that contributing to increase the pipeline of women into radiology, because as we increase our numbers, you know, that's going to project in the leadership pathway. So I believe one of the deterrents of, you know, seeing more women in radiology is that radiology is not highlighted in medical school, and many medical students do not have, you know, access to experience how awesome our specialty is. I was lucky. I had already completed my medical school, took an elective during internship, and I fell in love with radiology. So that's, I think we need to work more, at grassroots level, medical school, even high school, to, start showing that this specialty has so much to offer to women. So we have, more people going into the leadership path.
And I think having events like this, where women across the country are getting together to connect, women, farther along on the leadership spectrum, those that are just starting out, medical students, residents, fellows, making connections and networking at events like this is just very, very rewarding to see that people are interested, that we want to help each other. It's not a competition. We really do want to mentor one another, connect, and sponsor one another. So events like this, I think, should happen periodically and continue to grow, and we'll get more momentum. So thank you to the organizers.
Thank you so much. I can't thank you enough for all of your expertise. At this time, so panelists, please leave your videos on, and I'd like to request that everyone else turn your videos on. Make sure you're looking at gallery view so we can take our group event photo. And this was such an informative and important panel. I really appreciate, on behalf of our entire organizing team, everything that you've said tonight, as we kind of rise through our careers and face these internal questions ourselves, but really never know the answers. And, it's hard to even reach out to someone who may know the answers many times. So I'd also especially like to thank all of the co-moderators and the co-organizers and staff who've supported this event. It took a army, like they say, it took a village of effort, and wanted to specifically give a shout out to Desi Scheist, who's the brains behind this event. So thank you, Desi, for your leadership and everything that you've done to help us put this together. All right, so it looks like we have oh, no, we still have people joining us.
Yes.
Okay. I'd also like to put out a plug for if tonight I saw all these great ideas and questions come up in the chat. If there are specific topics that you're interested in for our next event, I definitely encourage you to email me, email us, post it on Twitter, tag us, anything that you can do so we can keep this conversation going. And specifically, Dr. Bencardino, completely agree. Like, we definitely need to get the excitement for how great our field is early on at a grassroots level. So that, I think, creating this ongoing conversation will definitely help us do that.
Can we say cheers?
Yeah, so you can say virtual cheers. Cheers and toast to everyone.
Cheers. Oh my God.
Thank you to everyone who participated.
It's
We
very
appreciate
clean,
it.
but it's just driving me crazy.
It added to the drama of the panel.
Great to see everyone's faces.
Well, I think this concludes our event. Thank you, everybody. We appreciate it. And look forward to more.
Good night.
Bye.
Bye-bye.
Thanks, Pam.